Hello, I'm Vicky, creator and founder of the Mummy Tummy Transformation Program and pregnancy and postnatal fitness specialist. Today I'm going to show you how to engage your core and your pelvic floor. I see loads of women after they've had a baby and during pregnancy as well, trying to do abdominal exercises, whether it's exercises to effectively strengthen their core, whether it's Pilates exercises, but they don't actually know how to switch those tummy muscles on during the exercises. And often they're in the wrong actual position, especially with their spine. This then affects the results of the exercise. It doesn't make the exercise particularly efficient for you. So it's really important to switch and turn the muscle memory back on in both the pelvic floor and the core. And when I'm talking about the core, I'm talking about whole of your midsection. So I want you to think about your shoulders right down to your glutes, okay, including your glutes. Your glutes are your bottom muscles. So the whole of your midsection, that's your core. You've got several layers of stomach muscle. You've got your deep transverse abdominis muscle, okay, which wraps around your entire spine. You've got your rectus abdominis muscle, which is the six pack if you ever had one, which is just here. And it's a paired muscle. And it's just separated here by the midline, called your linea alba. That's not a muscle, but it's your linea alba. You then got lots of muscles around the spine, smaller muscles, posterior muscles, the QL muscle, for example, quadratus laboris, that muscle there. And then also you've got your sacrum and you've got your multifidus muscles as well. So it's really important that we're engaging all those as a unit together to make the exercises effective for you. So I'm going to show you 3 different positions, okay, in terms of engaging your core muscles, and also how to get into a neutral spine position so you can actually feel the exercises working. So first of all, we're going to start off lying on our back. Going to have our knees bent on our feet flat to the floor. And we're going to first of all find neutral spine position. So I'd like you to take 2 fingers of each hand and place them on the bony part of the pelvis here. We're going to engage our transverse abdominis muscle, the deep innermost muscle, with the pelvic floor and find neutral spine. I'd like you just to tilt your pelvis up a little and inhale, and then exhale, roll your pelvis so that your tailbone, that's the base of your sacrum, goes away and up. Inhale, exhale. So it's a gentle rocking motion of the pelvis. It's a pelvic tilt. Inhale, exhale. Inhale, exhale. Now we're going to do 4 more of these. Inhale here, exhale, tailbone away and up. Inhale, exhale. 2 more. Inhale, exhale. 1 more. Inhale, exhale. You're going to hold your back in this position. I'd like you to just slide your 2 fingers down towards your pubic bone here and make sure that that pubic bone is lying level with your pelvis. You're going to lift up your pelvic floor. To do that, just imagine that an elephant's trunk is coming down to pick up a pebble. It's a small lift action, and remember the pelvic floor is an internal muscle just lying underneath the bladder, so you can't see it as such, but as if you were moving a bicep, you want to get a similar movement so the pelvic floor comes up. Alternatively, just imagine you're zipping up your front passage, your vagina up towards your pubic bone. All right, then let your belly button, draw your belly button down towards the floor just gently, but keep your ribs relaxed and your shoulders down. If you start hitching up your ribs, you won't be in a neutral spine position and you'll have arched your back. So neutral spine is when your lower back is lightly brushing the mat underneath you and your pelvis here is lying level and flat with your pubic bone. Your ribs are relaxed and so are your shoulders. All right, and you're lifting up your pelvic floor and drawing your belly button down. All right, now we've got some slight engagement. We're going to move on. I would like you to place your hand or one hand just on your lower abdominals right across here, so just below the belly button, as if it's the place where as if you were wearing a belt. Okay? You're going to inhale and just relax your ribs, and your belly button should just slightly rise. There's no need to push your belly button up. You just want to allow the belly button to slightly rise. I'd then like you to think pelvic floor. I'd like you to exhale. Draw your pelvic floor up, so it's a small zipping action, and let your belly button sink down into the floor underneath you. A light core connection is what you should feel here, and you've got that lift up of the pelvic floor. Ribs relaxed. Inhale, let the pelvic floor go down, let the belly button rise up ever so slightly. Exhale, zip up that pelvic floor, lift the pelvic floor up, belly button goes down into the floor, it melts down. Inhale, relax. And again, zip up the pelvic floor, belly button goes down. Inhale, relax. So the breathing's really important. Make sure you breathe out now, zip up the pelvic floor, hold it up and draw the belly button down. Down, 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 down. Now remember those ribs, they need to stay down and relax. Please don't lift those ribs up, okay? And then inhale, release. Exhale, zip up the pelvic floor, belly button down, 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 down. Okay, inhale, release. Roll over, come up to a seated position. So that is how to engage your core when you're lying flat onto the floor. And that's how you want to be engaging your floor when you're doing the exercises on your back. Now I'm going to show you how to engage your core and your pelvic floor in a seated position. And this is particularly useful if you're feeding your baby. So I'd like you to sit up really tall. Imagine somebody's growing the crown of your head up towards the ceiling. And you're just resting on your sit bones, okay? It's the bony part in your bottom muscles, okay? So you just feel those. But whatever you do, make sure you're not slouching back. You're sitting up really tall. I'd like you to place your thumbs just at the belly button here and the first two fingers of each hand pointing down onto the pubic bone. Relax your shoulders, relax your chest, relax your ribs. Inhale. Zip up that pelvic floor. So I want you to lift the pelvic floor up, just a slight move, and draw your belly button back and let it sink down at the same time. Inhale, let everything relax, pelvic floor down, belly button just comes forward slightly. Exhale, so imagine you're zipping your vagina up towards your pubic bone and the belly button is coming back and down. Inhale, relax. Breathe out now. Zip up, vagina to pubic bone, belly button goes back and down. Inhale, release. Exhale. Inhale. Exhale. Inhale. Keep going, and I'm going to show you from the side. So I'm sitting up really tall, right on my sit bones here. Thumbs in the belly button, first two fingers down on the pubic bone. So exactly the same, I'm just showing you the action from the side. So your ribs are relaxed, your shoulders are relaxed, your chest is relaxed. You inhale to prepare, breathe in. Exhale, draw your vagina up towards your pubic bone, so you're lifting up that pelvic floor. Exhale, keep breathing out, draw your belly button back inside you as if it's coming away from your top and down. Inhale, belly button forward, pelvic floor down. Exhale, lift up that pelvic floor, belly button goes back. Inhale, release. Exhale, zip up, belly button back. Inhale, release. Exhale, zip up, belly button back. Inhale, release. Keep going, and you want to feel light tension across the lower part of your abdominals when you do this, and you must feel that little lift of the pelvic floor muscle coming up inside you. Inhale. Now we're going to go slightly slower, so you're going to do the same action. Zip up that pelvic floor, vagina up towards the pubic bone, belly button goes back. And I'd like you to hold both the pelvic floor up and the belly button back, but breathe. Hold it for 5, 4, 3, 2, 1, and then release the pelvic floor muscle down and let the belly button come forward to relax. Exhale, zip up again, draw your belly button back and hold for 5 if you can, 4, keep breathing, 3, 2, 1, inhale, release. One more time, exhale, zip up the pelvic floor, draw the belly button back, hold for 5, keep breathing, 4, count out with me, 3, 2, 1, inhale, release. Excellent. One more position to engage your core and your pelvic floor, and I like this position. You can really feel the muscles. So we're going to come onto all fours. Your hands are going to be directly underneath your shoulders, and your knees are directly underneath your hips. You want your back to be flat. You're going to just look down towards the floor, but keep your neck in line with your spine. You're going to inhale and just let the belly button go down to the floor. Exhale, draw the belly button up, but at the same time, lift your pelvic floor muscle up. Inhale, let it relax. Exhale, zip up your pelvic floor. So again, vagina up towards the pubic bone and belly button up towards your back, the parallel point of your back here, and then inhale, relax. You want to keep your hips really still and your back. So avoid arching. Okay, that's a different move. Inhale, relax. Exhale, zip up your pelvic floor. Draw up your belly button towards your spine. Inhale, release. And again, exhale. Zip up that pubic bone. So vagina up towards the pubic bone. Belly button up towards your spine. Feel that connection here and into your pelvic floor. Inhale, release. We're going to pulse that move. So you're going to exhale up. Inhale, release. Exhale, pelvic floor up. Belly button up. Inhale, release. Exhale. Inhale. Exhale. Inhale. Really activate that pelvic floor muscle. Activate those deep abdominal muscles called the transverse abdominis, so we can really bring the muscle memory back and really strengthen your core from within. Pelvic floor up, belly button up, inhale, release. Exhale, make sure you get that breathing correct. So you're breathing out, drawing the belly button up towards your spine here, lifting the pelvic floor, inhale, release. 2 more, up, inhale, release. Up, inhale, release. And this time, we're going to go slower, so you're going to draw the pelvic floor up, draw the belly button up, and we're going to hold that for 5, 4, 3, 2, 1. Inhale, release. One more time, exhale, draw it up. 5, 4, 3, 2, 1. Inhale, release. Last time, be sure to think pelvic floor and deep abdominal muscles. So zip vagina up towards the pubic bone, draw the belly button up towards your spine, hold for 5, keep breathing, 4, 3, 2, 1, inhale, release. And then just take a seat. So you want to be practicing how to engage your core and your pelvic floor on a daily basis after you've had a baby, or if you had your baby a long time ago and they're now older. It's really important that you're engaging and getting the muscles working as a system, as a unit. Okay, the muscles don't work separately. They must work all together. So that's why it's so important to engage your pelvic floor muscle, which is the most important muscle of your core, with your deep abdominals. So I hope that was useful for you. Don't forget to post your comments in the comments box below. Any questions you have, please post those too, and give this video a big thumbs up if you liked it. Thank you for watching, and I'll see you next time.